last thing that we're going to talk about today are the stages of shock. Okay, your textbook covers 2 stages of shock. I was always taught that there are 3 stages of shock, so I'll explain to you the 3rd stage very briefly, but it's not covered in your textbook. Okay, the first stage of shock is compensated shock. What is compensated shock?
This is when your body is able to cope with the insult and deal with the process of whatever shock is happening.
Okay, so your body is able to compensate for whatever injury or insult happened to it. And at this point in time, your body is still trying really, really hard to make sure that it's going to stay healthy and appropriately perfused. So what are we going to see? What are some of our signs of compensated shock? There's a really nice table on it on page 496. So what are the signs of compensated shock?
Agitation. Restlessness. A feeling of impending doom.
This patient's going to say, man, I feel like I'm going to die. What's the next one?
Altered mental status.
Okay, in the later stages of compensated shock, we may see an altered mental status. What does altered mental status mean?
They start failing to understand where they are or what happened, can't remember dates, can't remember events.
All right, so when we, earlier in the class, when we were talking about patient assessment, how were we assessing their level of consciousness or their level of responsiveness?
The term was alert and oriented times 4.
Okay, we were using A and O times 4. And we were using that in conjunction with a scale that's called the AVPU scale. Right? So between these two, we should be able to tell if our patient is experiencing an altered mental status. What does A and O times 4 mean?
Alert and oriented to person, place, time, and events.
Alert and oriented to person, place, time, and event. Okay. What is next in the signs and symptoms of compensated shock? Okay, we're going to see a weak rapid pulse. Why is it going to be weak?
Well, your blood pressure's dropping.
Your blood pressure doesn't usually drop until we get into decompensated shock. But why are we going to have a weak pulse here? What does it take to have a strong pulse?
Energy.
Takes energy.
Yeah, that's what I would have said. Strength.
Takes
Stamina.
strength. Okay,
So if you're still strong,
if you have a rapid pulse, they kind of go hand in hand, right? If you have a rapid pulse, there's not enough blood returning to your heart fast enough for you to also have a strong pulse.
so your heart is trying to speed up to make up that gap.
Right. So your pulse feels weak because it's so fast. So in compensated shock, we're going to see an increase in our pulse rate. What else are we going to see?
Clammy skin.
Pardon?
Clammy skin.
Clammy skin. What does clammy mean?
Pale.
Or moist.
It means moist. Moisture. Okay. What else are we going to see in compensated shock?
Color is going to be off on the skin. Cyanosis around the lips, maybe.
Okay. We could see some cyanosis.
Shallow and rapid breathing.
Yep, we're going to see an increase in respirations. Your body's trying to get as much oxygen as possible around as quickly as possible. So our respirations are going to increase. Our pulse rate is going to increase. What's going to happen with our blood pressure?
Well, as long as these systems keep working, it's probably going to stay the same or drop just a little bit.
It may drop just a little bit, but more importantly, we're going to see a narrowing pulse pressure. Okay? So if a normal blood pressure is 120 over 80, we're going to see that gap narrow.
Is that gap going to narrow in all of the different kind of stages of shock, or are you only going to see that in situations like cardiac tamponade?
It's going to narrow in almost any type of shock. It may not be a significant enough narrow that you can see it, but it's going to narrow in all of the shocks. Okay? So we're going to go from 120 over 80 to 116 over 82. It's not really a lot, but we're seeing that pulse pressure narrow. Now, when you get on scene, if you show up and your patient has a blood pressure of even 112 over 88, are you going to know if their pulse pressure is narrowed? No. Why not?
Because you don't have a number to compare it to.
Because you don't have a number to compare it to. This is now your baseline. If you had gotten on scene and they had started with this, would this be significant?
Yeah. Oh, yeah.
Yeah. Okay, so you'd be able to tell that your patient was in shock because your pulse pressure is narrowing. Okay, what else are we going to see?
Air hunger.
Air
Shortness of
hunger.
breath.
That goes along with our rapid, shallow breaths, right?
Yeah.
They're starving for air. They're like, give me it, give me it. I want some. So we're going to have air hunger. Shut up.
Next is nausea and vomiting.
Okay. Why might they experience nausea and vomiting?
Well, the nervous system is starting to react to what's going on. And
What is your body's initial reaction to any type of insult or injury?
take blood from non-essential places and put it to essential places.
You have a fight or flight response, right? Is our GI tract essential? Nope. So our GI tract, which is used to being very well oxygenated and having a lot of blood, suddenly doesn't anymore. Because it's not important to us when we're suffering from an injury of this magnitude. So we're going to feel nauseated, or we're going to feel like we need to vomit because our GI tract doesn't have any blood down there anymore. Make sense? Okay. All right, let's talk about decompensated shock. What is decompensated shock?
When the blood pressure is falling.
Well, the body is no longer able to compensate. So this is where you start losing ground and things start decreasing.
Correct. So your body is no longer able to compensate for the injury that it's been given. So we're going to start seeing a decrease in blood pressure. What else?
Labored and irregular breathing.
Okay, we're going to have a hard time breathing. We may even see a decrease in our respiratory rate. What else?
Change in skin color, cyanotic, ashen or mottled skin.
Okay, so we have another change in skin color. What else?
Your turn.
Thready or absent peripheral pulses.
Okay, so our peripheral pulses may disappear. What's a peripheral pulse?
The pulses in your feet, in your hands, wrists.
The pulses in your feet and your hands. Okay, so if we can't feel our dorsalis pedis or posterior tibialis, we can't feel our radial pulse, that means that our blood pressure is too low.
Less than 90 at that
Less
point.
than 90, yep. Peripheral pulses leave. I should say are absent, whatever, but they leave, okay? What else?
Dull eyes, like dilated pupils.
And
Poor urinary output. Hope that doesn't happen.
I'm not going to see urinary output, I hope, cross my fingers. I'd rather see urinary output than vomit, just so you know. I don't do vomit. I've never done vomit. My poor kids would puke in the middle of the night and they have to clean themselves up because I do not do vomit. You think I'm joking? I'm not joking. I don't do vomit. All right. Then the last stage of shock that I was taught about, but is not covered in your book, is called irreversible.
Shock, coma, death.
So, as its name says,
Yeah.
irreversible shock is irreversible. Can't fix it. Everybody dies.
I'm taking this home with me. I don't know what I'm gonna use it. I'm taking it home.
Okay. All right. Okay, how are we going to treat shock? We talked about it a little bit, but how are we going to treat shock?
Really using the tools of patient assessment, we're going to make sure that the ABCs are observed. Make
Okay.
sure that their primary systems are working.
Okay, so we're going to ensure that their ABCs are protected. How are we going to do that?
Well, ensure an open airway. Ensure they're not bleeding out.
Okay, so we're going to make sure that their airway is open and patent.
The bleeding would come first. But
If
yeah.
we see massive amounts of bleeding, yes, the bleeding would come first. But we're going to open their airway, make sure that it's open and patent and well protected. Along with airway, we have breathing. What do we have to do to ensure that our patients are breathing appropriately?
See that there's adequate chest rise. See that they have decent color.
What if they don't have decent color?
And they're probably not perfusing well, so we have to put some oxygen on them.
Oxygen. Okay, so in our ABCs, we're going to make sure that we provide O2 if available. Okay? Then, we're going to make sure to stop any bleeding that isn't what I want to say. We're going to make sure that we stop any bleeding that we can. Okay? To treat shock specifically, shock undefined, not hemorrhagic shock, but just to treat shock, what else are we going to do?
Maintain body temperature.
Okay, we're going to maintain body temperature. How are we going to do that?
Use blankets or, well, depends on what situation you find them in, because sometimes it's a case of you have to remove them from an environment that's going to disrupt their body temperature. In other words, if you got somebody who's laying on the ice, you need to put them on a backboard or something so that you get them off the ice. Cover them with a
Right.
blanket or such.
So we need to maintain their body temperature, so we're going to try and keep them warm.
Get them indoors, get them in the ambulance.
Okay. Then what's one of the last things that we're going to think about as we're treating our patient for shock? Where do we want their blood to be? Do we want their blood to be in their toes? Where do we want it to be?
In their core.
In their core or in their brain, right? So we're going to lift their legs 6 to 10 inches. Now, we're only going to do this if it's not going to cause our patient pain, or if we're not going to cause further harm to the patient by doing it. Okay? If our patient is on a backboard, it doesn't take a whole lot to lift the end of the backboard up. Right? I think we get to spinal immobilization pretty soon in this class.
So the 23rd,
So it doesn't take a whole lot to lift that up.
the 19th.
All right.
Then you want to put the patient in a position of comfort as much as you can.
We do want to put them in a position of comfort, but if they're in shock and we're
Right.
treating them for shock,
Depending on what the injury is, of course.
yeah, it's hard to put them in a position of comfort if you have to try and maintain their airway. So Position of comfort is absolutely important for your conscious, alert-oriented patient. Okay. Okay, any questions about shock? Any questions about our treatment for shock? We forgot one. You can't fix what caused them to go into shock. You're not a doctor,
Okay, cool.
okay? So you have to make sure that you get them to one. So the next thing that we have to do is transport.